To answer, and it's more practical because it's happening on the ground. You know, Makueni County uses more than 40% of what we get to allocated to health. Our hospitals, most of them are being run by hospital contracted locally. Locally, hospital contracted staff. Trained, but they are being paid a third of what those who are P&P are earning. Yet those are the story on such staffs, and recently on such staffs, and recently the board employed those who are on contract to permanent. Do you have a plan to absorb those who are in hospital contracts to fill those positions to be under contract, which is better? Because what was happening, the contracts given by the board are a bit better, but what the hospital is offering. And there is also, we have staffs who are being paid below the minimum wage bill. Recently, when we went around with the Senate Advisory Committee, we met some people who are earning below that. What's the role of this board in advising our hospitals to pay people within the criteria? We are putting a lot of money in our hospitals, but if we are going to run people who are already discouraged, the board must come in to find out a lasting solution, to find whether you can be able to observe those people on contract or give a minimum guide what to pay a clinical officer, a nurse, a lab technologist. Because if you leave it to the board, to the local hospital boards, they are giving it below. And you can imagine if you are serving the same hospital, comparing with a permanent staff who is earning 3 times you, how do you expect that person to really give their time? And I request you to answer that practically and how you will handle that. The other point I want to hear is your position on leave of absence. Because we know in Makueni region we had conflicting issues, because we had staffs who had been on leave of absence from the other region and they were reinstated in their jobs and they are working. While those who wanted to have a leave of absence within this from 2023, 2022, they were denied. We need a clarity and know the position you take on that if you are made the chairman, if you succeed in this position. Because we cannot have a conflicting situation where the board contradicts what is practically being practiced in everywhere, even at the national. The other question, finally, I would wish to hear, how do you intend to deal with the cases of ghost workers, absenteeism, and nepotism in county employment? Not forgetting, there was also another question I was to ask. Recently we had surgeons, consultants, top consultants in our hospitals resigning and going elsewhere. Top consultants. The board would adamantly refuse to give them a top position like job group S while they are being given by other counties. If the board would say they would not be able to give them direct because there must be methods of earning that. But this is a person who is saving the county millions of shillings. So because of that patience, we lost several top consultants and they were employed elsewhere. Radiologists, consultant radiologists who could have saved us a lot of money. We do not understand why the board will not see it that way. We would want to hear, would you consider, when we have such top employees who are saving this country and saving our people a lot of money, being given the position they deserve? Because if you don't, they'll be given by another county and you go back to square zero. Thank you.
Thank you very much, Chair. I think I'll unpackage the 4 questions from the member. The first one is about meritocracy and inclusivity in recruitment. in all fairness, given the opportunity, we'll be able to run a board that is devoid of nepotism and making sure that recruitment are competence based. And one of the key things is really looking at technical competence based interviews when recruiting. And one of the key things we'll be looking at is how to even do online questionnaires, because if you do online questionnaires with a dashboard, you are also trying to eliminate the human error in the scoring, and even doing psychometric.
For who just came 2 years outside, that shows we are not protecting our people. We need to hear those staff. That shows we are not protecting our people. We need to hear those staffs are waiting and they're listening to this interview. How the board will handle them. How the board will be, whether they are going to work with a lot of vigor and strength, or whether they will have hope. So look straight to a chairman and tell us that these staffs will be having more points when they come to recruitment, because they've been earning. They must have earned. They have served it for several years, being paid nothing. So when an employment opportunity comes, how will you put them? How will you place them? Thank you.
Thank you very much, Honorable Mbalu. Looking at the passion with that question, I would be facing you, but since you have directed that I see the chair,
yes.
I would be happy to look at. One of the key things is I will try to start by addressing the challenges facing the County Public Service Board during recruitment. Issues around nepotism. I had already alluded to the issues about political interference and political influence, issues around corruption, issues around technical